Hello everybody, this is Dr. Bob DiMaria. Today I would like to talk to you about peripheral neuropathy and the feet and the hands. Some of you watching me right now already know that you have peripheral neuropathy and you've been taking various medications that have not helped your progress. Well, I have some really good news. We focus as the drugless doctors on a three-tier approach: neurochemical, neurostructural, and neurovascular. So what does that mean, Dr. Bob? We're going to help the structural integrity of your nerves. We're going to be helping you increase the vascular aspect of your body. And then finally, we're going to work on making appropriate and necessary dietary recommendations. I want to go through some of the testing procedures that we do. Now, some of you may want to get a mobile kit that we could send you anywhere in the United States and or visit us in Westlake, Ohio, or Naples, Florida. So let's get started. This is called a cryo stick. It's a cold stick, and we start by placing this on our patient's or our practice member's face. That would be a 10. And then we put that to the foot, both sides, and we grade the amount of loss. So maybe some people only can notice 50% compared to what it was on their cheek. Repeat the process with the hands. So that's a cold sensation testing. The next test that we like to do is we use this tuning fork, and the tuning fork oscillates. It's vibration. So we start with the head being a level of 10, then we apply it to the elbows for the upper extremity for individuals that see the amount of vibratory loss, because you're going to lose vibration sensation if you have decreased blood flow and nerve flow. And then finally, we oscillate it again and we put it on both feet and we measure the amount of sensory loss, and that is vibration. We have a very interesting tool here. This is a pinwheel. Once again, we could use the face as the base, getting that to be a level of 10, and we can apply it to both hands and both feet. So we're going to ask you questions. How much sensory loss do you have when you evaluate that? Because our peripheral neuropathy test is about sensory loss. Another tool that we like to use is the monofilament, which is a light touch that we apply to your hands, and we evaluate that in 5 spots on the top of your hand and the top of the feet, and we evaluate the amount of sensory loss. So this is the monofilament testing. Another test that we like to use is a very specific pinprick. So this is more of a pain sensation. We can apply it here to your face, getting a level of 10. Then once again, we apply it to your hands and feet, and we're looking for the amount of sensory loss or sensory impairment. We also have another tool that we like to use more towards an aspect that you would need to come and visit us either in Westlake, Ohio, or Naples, Florida. These are electrical mitts. You can say, what does that mean, Dr. Bob? We literally turn them on. There's an electrical charge that's going through there. Let's say we start at a level of 5 and we put it on an individual's feet and legs, and if they do not feel it, we slowly increase the number to 10. And if their partner is there with them and they don't feel it, but I can tell you, when whoever is there with them touches it, they are literally shocked at the response because the individual that they're with did not feel it. So that could be part of a neurochemical, neurosensory, or neurostructural loss. So we talked about cold with the cryo stick. We also evaluate heat. We turn our hair dryer on, we apply it to both the hands and feet for a period and a count of 3. And we're looking to see if an individual does feel that temperature. So we have different extremes. We use the cryo stick, which is really cold. So we're looking at the whole equilibrium. We're looking at the whole sphere of coldness. And then we also can use a little bit lower temperature. It's not as cold as the cryo stick, evaluating again a score of 1 through 10. Another very interesting tool that we have and a part of our chemical, neurovascular, and neurostructural improvement is nitric oxide. So a part of our goal is increase oxygenation in your whole body. I like to think of peripheral neuropathy in your feet and even in your hands is literally having Alzheimer's or dementia in your feet. You say, really, Dr. Bob? It's all about reduced blood flow. What happens in the feet is the furthest distance from the heart. We have a nitric oxide stick. You put it in your mouth and you can evaluate the amount of nitric oxide that you have in your body. When we do our evaluation, we're looking and we're creating a number. If you have 20% loss or more in your body, that means your body is breaking down faster than it's being restored. So I want you to understand we're looking at this neurovascular, neurochemical, neurostructural. A lot has to do with dietary changes. Some of you may have to go through making some major dietary food changes to reduce the amount of inflammation in your body. And finally, we have a very interesting tool here. This is a temperature device that we can use to literally evaluate the temperature of your hands and feet. And you can see my hand right now is yellow. We want yellow, we don't want orange. So I know that I have good vascular circulation in my hands, and I know in my feet. If you'd like to have these tests done, come and visit us in either Westlake, Ohio, or Naples, Florida, or we can send you your own test kit and we'll work you through it to evaluate your amount of sensory loss. Thank you so much. I'm Dr. Bob DiMaria.